Welcome to Holistic Health Vibe, where healing begins within. Have you ever wondered if your body could give you early warning? Signs before you actually feel sick? The truth is, it often does. And the best part? You don't always need expensive equipment or a trip to the doctor's office to notice them. In just 10 minutes, you can perform a few simple health checks at home that may help you become more aware of your overall well-being. So, what are these checks and what can they really tell you? Let's find out. Before we begin, it's important to remember that these home checks are not meant to diagnose diseases. Think of them as checking the dashboard of your car. A warning light doesn't tell you exactly what's wrong, but it lets you know when something deserves attention. By the end of this video, you'll learn 5 simple health checks, what they can reveal, and when it's time to consult a healthcare professional. Let's start with your heart. Sit quietly for about a minute and allow your body to relax. Then place 2 fingers on your wrist or the side of your neck and count your pulse for 30 seconds. Double that number to get your resting heart rate. For most adults, a resting heart rate between 60 and 100 beats per minute is considered normal. Although physically active people and athletes often have lower resting heart rates. If your resting heart rate suddenly becomes much higher or lower than usual, especially if it's accompanied by dizziness, chest pain, or shortness of breath, it's a good idea to seek medical advice. Your heart is constantly working for you, and learning what's normal for your body is one of the easiest ways to notice changes early. Now let's check your breathing. While sitting comfortably and breathing normally, count how many times your chest rises in 1 minute. Most healthy adults breathe between 12 and 20 times per minute while resting. Your breathing rate may increase after exercise, stress, or excitement, and that's perfectly normal. However, if your breathing remains unusually fast, feels difficult, or is accompanied by chest discomfort, it's important to contact a healthcare professional. Breathing is one of the body's most important vital signs, yet many people rarely pay attention to it. Next is your waist measurement. This check isn't about appearance or fitting into smaller clothes. It's about understanding one important marker of health. Using a measuring tape, measure your waist just above your hip bones. Carrying too much fat around the abdomen has been linked to a higher risk of conditions, such as heart disease and type 2 diabetes. Health organizations often suggest paying closer attention if waist circumference is above about 40 inches, or 1 or 2 centimeters for men, and above about 35 inches, or 88 centimeters for women. These numbers are general guidelines, and may vary depending on factors such as ethnicity and body type, but they can still provide useful information about your overall health. Now, take a moment to look at your skin and the inside of your mouth. Stand in good lighting and check for any new or changing moles, unusual rashes, sores that don't heal, or changes inside your mouth, such as persistent ulcers or bleeding gums. You're not trying to diagnose a condition yourself. Instead, you're simply becoming familiar with what's normal for your body so you can recognize changes if they occur. Many health conditions are easier to evaluate when changes are noticed early and discussed with a healthcare professional. The final check is a simple balance test. Stand near a wall or sturdy chair for support if needed. Lift 1 foot off the ground and see if you can comfortably balance for about 30 seconds. This quick exercise can give you an idea of your balance, coordination, and lower body strength. Keep in mind that balance naturally changes with age, and factors such as fatigue, medications, or inner ear problems can also affect it. The goal isn't to achieve perfection, but to notice changes over time. So when should you stop relying on home checks and seek professional medical care? If you experience chest pain, shortness of breath while resting, fainting, a rapid or irregular heartbeat, unexplained weight loss, or any symptom that is severe, persistent, or getting worse, don't wait. Contact a qualified healthcare professional as soon as possible. Home health checks are useful for increasing awareness, but they should never replace a proper medical evaluation. Here are 4 simple habits you can start today. First, check your resting heart rate once a week and learn what's normal for you. Second, pay attention to your breathing whenever you're feeling unwell. Third, measure your waist once a month instead of focusing only on your weight. And finally, spend 1 minute each month checking your skin and mouth for any noticeable changes. These small habits take very little time, but they can help you become more aware of your health and encourage healthier lifestyle choices. Your body is constantly sending you signals. The more familiar you become with those signals, the easier it is to recognize when something changes. Remember, these simple checks are tools for awareness, not diagnosis. If something doesn't seem right, always seek advice from a qualified healthcare professional. If you found this video helpful, Don't forget to like, subscribe, and turn on notifications for more evidence-based health tips. And let me know in the comments. Which of these simple health checks are you going to start doing this week? Thanks for watching. Stay healthy, stay informed, and I'll see you in the next video.